Hello everyone, and welcome to our series of seminars for ADHD Awareness Month. My name's Dr. Amy Holmes, and I'm here to talk to you today about women and ADHD. ADHD can present differently in women across the lifespan due to fluctuations in hormones, but also because of the societal responsibilities we have at different stages in our lives. For example, specifically due to childbearing, and the fact we're also more likely to have multiple hats, including caregiving and everything else that involves. A recent Delphi study showed that hormones and consideration of these roles were not explored as comprehensively as women would like in ADHD assessments. So why is this important? A major reason is the hormonal shifts in the female menstrual cycle can have a major impact on ADHD symptoms across the whole lifespan, as can the general life cycle of a woman and our roles at home and in society. From adolescence, estrogen can spike and dip, which influences dopamine levels, attention, mood, and emotion regulation. There's a crossover between premenstrual dysphoric disorder, or PMDD, diagnoses and ADHD due to the lower estrogen levels and higher progesterone levels in the luteal phase, which can intensify mood instability, irritability, and focus difficulties. Women can be misdiagnosed with mood disorders and PMDD when in fact it's ADHD. Hence, the importance of asking these questions in assessments of young cis women. Pregnancy and postpartum changes can be interesting in ADHD. Women with ADHD can find that as estrogen rises significantly during pregnancy, this can actually lead to an improvement in ADHD symptoms, although this might not be felt if there are other factors at play, for example, previous trauma. However, after birth, there can be a postpartum estrogen crash, which can worsen executive functioning, so the brain's ability to focus, problem solve, make decisions, and regulate our emotions and provide us with mental clarity. Also, as many women have more child-caring responsibilities and more emotional load, they notice ADHD symptoms due to the increased cognitive demands and difficulties in managing daily responsibilities. Their symptoms are amplified as they're now caring for children and are more likely to be the stay-at-home parent who also shoulders more of the work in the house. And finally, in menopause, there is a gradual decline in estrogen starting between 5 to 10 years prior to menopause, in perimenopause. And these fluctuating levels of estrogen impact on physical, mental, and emotional aspects of life. As the estrogen declines, so too does dopamine and serotonin, further impacting mood and energy levels, concentration, and stress tolerance. So, what do we recommend? The Balance app can be great in helping you chart your hormonal fluctuations, especially in perimenopause, and this can also prove useful in any ADHD assessment or subsequent medical treatment if that's the route that you choose to go down. However, the most important message is these hormonal fluctuations and our role in society as often bearing more of the mental and emotional load in a household can have a really big impact on us, especially if we have ADHD. So do consider all this when you're having a day when you are being particularly hard on yourself, or if you leave your keys in the fridge.